what we do and carry on engaging with us. American College of Physicians produced a charter in 2002, and that is exactly the kind of things I've already highlighted. But it is also important that when we look at professionalism, we look at the system, the healthcare system within which we practice. If you are in a fully funded private healthcare system, there are going to be different demands, different issues related to a totally fully tax-funded healthcare system. So the challenges are for us, particularly on focusing the commonality in whichever system you work in, the commonality, the common features are going to be about self-regulation. And if you identify what are the factors in self-regulation, if people do not come up to those standards, what do we do to help them overcome those problems? And again, both the Royal Colleges can look at remediation and how do we support people who are struggling. Because if you look at it, training in medicine and training in psychiatry, we are talking about 9, 10, 11, 12, 13 years of training. It is very expensive. So is it really fair that having invested so much money and time that we do not take into account how do we support people when they're feeling stressed and when they're feeling under pressure? So the core attributes are about specialized knowledge, which is, as I said earlier, is about technical knowledge. It is about autonomy in practice. Now, I may like to practice in my clinic in a particular way, but I still have to be answerable to the General Medical Council, to the Royal College of Psychiatrists, to my patients and their families. And again, just because I like method A of treatment does not mean that if there is no evidence that that works, does not mean that I can carry on delivering that, because that would be a complete waste of resources. And there's also a challenge in delivering altruistic service. And that raises some very interesting cultural points. Again, different cultures have different meanings. If you're working in a full-time private practice and you're charging patients fees for your time, then if you decide that one afternoon a week I will see patients free, that is altruism. But if on the other hand, government is paying your salary, what does it mean to be altruistic? So again, between the two colleges, we can have a discussion as to how do we encourage that as part of the professionalism agenda. And obviously, as a professional, we have to be very aware of maintaining and expanding professional knowledge and skills as things change, as a knowledge base changes. So it is important that professionalism gives us a legitimate authority, and that is why patients trust us, that's why politicians trust us, and that's why public trusts us. So the relationship with the patients has to be honest, fair, legal, and ethical. And again, there are challenges as patient expectations are changing, and certainly in the UK, politicians are pushing patients to become consumers. So you have a choice. You go into a supermarket and you can choose between 5 different kinds of mango juice. So there is a pressure from the politicians to say that the patients have a choice. But in reality, that choice in psychiatry is very limited, particularly when there are government-funded services, whereas in private practice, it's easier to say, well, I'll go to Dr. Smith rather than Dr. Brown, but and these are the reasons. So again, it will be very helpful to have some discussion on that. And the whole question about regulations and guidelines raises some very interesting ethical questions. And certainly in the UK, NICE guidelines, National Institute of Clinical Excellence guidelines, which we help produce, the Royal College of Psychiatrists is part of the National Collaborating Centre for Mental Health, along with British Psychological Society and others, to decide on topics, to decide on guidelines. But there is also a danger that if you go to one extreme of guidelines, then we all become technicians. So there will be an algorithm that if patient presents with condition A, symptoms B, then treatment has to be this, and there's no room to maneuver. But as a profession, we need to decide what role guidelines are going to have, whether guidelines should be guidance or whether they become something much more. So certainly in the threat, in the UK, the threat to professionalism is manifold. And increasingly, I remember seeing a patient in my clinic not so long ago who appeared with a printout from the net because as you heard earlier, I run a psychosexual clinic, and he sort of produced this and said, I have premature ejaculation and I want this drug. And I had never heard of the drug. So I really looked quite embarrassed about it. So I said, right, let's look at it. So, we looked at the net. And of course, I kind of felt very relieved when I discovered that the drug was not available in the UK. It had been developed and was available in the USA. So he knew more than I did, so that equality that is beginning to shift. So patients are becoming much more aware. Quite often they bring lists of side effects from various drugs, and if you haven't talked to them about side effects of antidepressants, they will challenge you. So that is a shift in professionalism. So we need to keep up to date with more and more specialization. And certainly, I think there are people who are dealing with very narrow field of psychiatric disorders. So then there is a challenge if they don't know about other conditions. So say somebody is running an eating disorders service and they can't diagnose depression. I'm sure you will agree that that is not fair. So there are those kind of challenges that we need to think about, and particularly in the UK, there have been imposition of policy without any evidence that the policy works. And we are beginning to regret some of those changes, and if we have time, we can talk about that. And I've already touched upon consumerism. And certainly also in the UK, nurses are being encouraged to take on prescription. And in America, there are 2 states out of 50 where psychologists have been allowed prescribing. And certainly in parts of the United States, nurses are given 2 weeks of training to prescribe drugs. Now, if that is the case, why are we spending 6 years in medical school learning about pharmacology and anatomy and physiology? So the politicians will turn around and say it's cheaper to employ nurses who can prescribe. So we need to be thinking about what our role is going to be and what we ought to be coordinating. So professionalism is an individual response to the highest demands of the chosen profession, and it is about wisdom in practice. It is about what we do. It's about experience. It is about knowledge. It is about standing back, thinking, what am I doing to this patient? And if I were in this patient's shoes, what would it mean? It also means increasingly that we have to be aware of economic factors, economic efficiency of drugs, economic efficiency of treatments, and see what